Congressman Marc Veasey, thank you so much and welcome back to Eye on Politics.
Good to be with you.
Nice to see you. So you have been on a tour here with Dr. Philip Wong, Dallas County Judge Clay Jenkins at the Dallas County Public Health facilities, and there's been discussion about cuts that Dallas County has seen in federal immunization dollars.
Yeah.
How big of a concern is this to you, and what's the solution here?
Oh, it's very sobering to think about a county as large as Dallas. And again, you know, it's beyond Dallas County. If you think about it, Dallas County is just one of many places in the Metroplex. And when you think about people going without immunizations, particularly for things that, you know, by people just coming in, can be a big difference in the spread of diseases like measles, meningitis, other things. And when you see these cuts, it's going to be detrimental not just for Dallas County residents, but really for the entire Metroplex. I think that everyone's at risk, and I think it's unnecessary, and I think the administration has unnecessarily put the North Texas community at risk by just playing the games that they are by making all of these cuts. And again, I think it was said early on during the administration, you know, they should be, if they want to make cuts, because I think all of us want to get rid of waste, fraud, and abuse, they should be bringing in a scalpel and not a sledgehammer, because this approach is going to make public health care in Dallas County and the entire Metroplex much worse for all residents here, regardless of where you happen to live.
And so what is the solution? Because, I mean, the cuts are in place, and Dr. Wong said he doesn't know what what's going to happen in the future, because there have been cuts made to Medicaid's growth, and so they're unsure about what's coming next.
Right.
So, I mean, does the state have to pony up a little bit more, in your estimation, if this is going to be the way, from the federal government?
Eventually someone will have to pony up more. I mean, I think it remains to be seen like who that will ultimately be. Is it going to be our local provider system through our hospitals? Is it going to be our emergency rooms and places like Fort Worth at John Peter Smith and Parkland here at Dallas, federally qualified healthcare centers? Someone is eventually going to have to carry this burden. It's not just going to go away. The problem with things like immunizations and the aftermath of not treating diseases that are very treatable, infectious diseases that are very treatable, is that someone ultimately ends up having to carry that burden. And I think that what's going to end up happening is that we're going to see an emergency situation like we've seen with measles outbreaks in different parts of the state. And maybe there will be some sort of infectious disease outbreak out of universities. I don't want that to happen, but then you'll see people all of a sudden have to act on it. And I think that unfortunately that's where we're headed, and that is the very worst way how to do health care. What would be easy would be for the president to meet with state leaders, meet with county leaders like Judge Jenkins and the Dallas County health staff here, and come up with ways how to prevent and prepare to make things not have to be so bad in the future. But unfortunately, what I'm seeing and what I've seen in the past is government won't act until something really bad and terrible happens.
So this is all happening under the broader context now that we're seeing redistricting here in Texas. You and I last spoke several weeks ago about the new maps, and I'm wondering, have you made any decisions as far as where you're going to run? Because as you know, I don't have to tell you, there are 3 districts right now in which Democrats represent North Texas, and under the new maps, it's likely to go down to 2.
Right, that is exactly right.
So have you made any decisions? Have you had any conversations with Congresswoman Crockett, Congresswoman Johnson about who's going to run for what?
No, not really. I mean, what I've been urging everyone to do is let's wait to see exactly what happens with this court action. I think that there are some serious violations that occurred in the district that I represent currently, which is 33. One of the districts down in Houston, 2 of the districts down in the Harris County area. I think there have been some very serious violations in the drawing of those districts, and I think that you could see a redraw before the primary starts. And what I like to always remind people that I think that everyone has forgotten, that when I got elected in 2012, I'll never forget, it was November, it was the day before Thanksgiving. I was out having dinner with my family when I got the call that the map had been redrawn and that the primaries were going to be delayed. And if you recall, back in 2012, the primary didn't occur until May 31st, and the runoff didn't occur until July 31st. And so it would not surprise me at all if you saw a delay in these primaries, because I think that there are some serious voting rights violations, and I don't think that the court is ready to throw the Voting Rights Act, particularly Section 2 of the Voting Rights Act out. And of course, when you have delayed primaries, all sorts of crazy things can happen. That was how Ted Cruz ultimately ended up beating David Dewhurst in the primary, was because the primary was delayed.
So, I mean, we've seen other members of Congress, starting to make announcements in other parts of the state.
Yeah.
And I know that Congresswoman Johnson just over the weekend said that she's looking at either 33, but she's not going to primary you, or 24. And Congresswoman Crockett, when I spoke with her, said that her house is in the new 33, and so she was considering that in addition to staying in 30. So somebody's going to be,
right,
if these new maps, go into place.
Right.
So, I mean, have you entertained the idea of, not running for Congress again?
I'm looking at all the different options. I haven't really had a chance to think long about that, just because I think that, again, there are a lot of different moving pieces and people are looking at different seats. And I do feel pretty confident that there will be some sort of changes to the maps, because the Republicans did overreach in the judicial part of all of this, and there's real discriminatory effects in these maps. And so we'll just have to wait and see. I'm not ready to come right out and say anything right now. I think it's too early, and I've just been really urging everyone in the delegation to let's wait and see, what happens, because I just don't think that, based on my experience in 2011 and 2012, I don't think that we've seen the last word on these maps.
So you think they are going to, these maps, because they're now in the courts,
right?
You think that the primary is going to be delayed?
I would not be surprised if the primary would be delayed. Yeah, if we move forward with these maps, it wouldn't surprise me, but it also would not shock me one bit at all, based on my previous experience, if we saw delayed primaries, and again, if we saw instead of a March primary, we end up seeing a May primary. Wouldn't shock me at all.
And how much of a chance? 50-50? Where do you
I think it's 50-50. Yeah. As a matter of fact, I think the way that the Republicans drew these maps, I think that they purposely drew them in order to have certain sections, particularly Section 2 of the Voting Rights Act. I think they specifically drew these maps wanting to challenge Section 2 in the Supreme Court. I don't think that Republicans drew these maps thinking that they would not be challenged. I think they wanted them to be challenged, and I think that someone like, Greg Abbott or Ken Paxton, who have not really been pro-civil rights Republicans at all, I think that they want to put that feather in their hat to say that they were the ones that went to the Supreme Court and they got Section 2 watered down even more or completely abolished. And I think that for them, there's a bigger prize, and I don't think that anyone is seeing that. The way that these maps were drawn, and again, in my opinion, they were drawn in order to challenge Section 2 of the Voting Rights Act and for it to go all the way to the Supreme Court. I don't think that they were, because the play is just way too greedy. They could have drawn these maps and only picked up 1 or 2 seats, and they could have done that without any sort of, and very little judicial action. But when they decided that they were going to go after 5, they knew that they were putting a bunch of red flags on this geography, and that ultimately it would be challenged in court.
And how easily do you think it will be for these plaintiffs who have filed updated lawsuits to win this case?
Yeah, I don't think it's ever easy. Of course, I'm not an attorney, and but I've been, on fighting on redistricting for a long time now as a staffer, as a member of the state legislature when I was on the redistricting committee, and now as a member of Congress, kind of seeing it up close and personal as it impacts me directly. But I can tell you that I I think that this is as bad and as egregious as I've seen Republicans in anywhere in the entire South decide that they are going to really take a shot at the Voting Rights Act. And so I think that there's a good chance, and I think that the plaintiff groups that have already filed, and probably some more that will eventually join, have a really good chance at winning when they get their day in court.
But timing is of the essence.
Timing is definitely of the essence. And I don't think that anybody wants a delayed primary, but I think that I think that that's the direction in which we're headed.
And because candidate filing is November 8th.
That's right.
Right now.
That's right.
And that still may be the case even if the primary is delayed, isn't that right?
Yeah, the filing deadline
is December 8th.
Yeah, that's right. The filing deadline is December the 8th, and they would just move those deadlines like they did in 2012.
So you think the deadline would be moved if, the filing deadline would be moved if in fact the primary is delayed?
Absolutely. Absolutely. It would have to, because they would have to be, the lines would be reconfigured. And so you would have to give people time to file in new districts and decide whether or not they were going to run, whatever it may happen to be. But I truly believe that these lines will change, and I think that the Republicans drew this map so we could have a showdown at the Supreme Court.
And do you think it will get to the Supreme Court? This case will get to the Supreme Court?
I believe it will.
And that's why you're saying hold off?
Right, exactly. That is why I'm saying hold off, because I don't think that we've heard the last word on Texas redistricting, Texas mid-decade redistricting in 2025.
So we're not going to hear an announcement from you anytime soon, is what I'm hearing.
No announcement from me anytime soon. I'm going to remain patient and wait for the legal battle to wind down. I think I may be the only person in the North Texas delegation that was around in 2011, 2012 when we did this last time. I think that everyone else, Roger Williams would have been a new member at that time too, but I think that we're the only two out of the entire North Texas delegation that remember those deadlines being moved and changed. And of course, District 33 in 2011 was initially drawn for Roger Williams, and he ended up being the member of Congress from District 25 that stretched from Fort Worth all the way down to Travis County.
Mm-hmm. And so as far as, because everybody is waiting to see.
Yeah, everybody's waiting.
It's a political domino effect.
Yeah,
right?
It is.
Because if you're running for one seat, then that impacts everybody else.
Yeah, that's right.
I guess same if you decide not to, right?
Right.
That impacts everybody else.
It impacts everyone else, yeah.
Do you anticipate facing a primary challenge?
I've never not had one. I've never not had a primary challenge, except when I was in the state legislature. As a member of Congress, I've always had one. So I would anticipate having one this time around.
And let me go back and bring it back to this discussion that we've had with regards to the health cuts. You sit on Energy and Commerce, which has control over Medicaid funding, right?
Right.
And so, when you hear this, why is this so important to you and to your district, Tarrant and Dallas counties, when it comes to public health funding? You sit on there, you have some seniority. You're the longest serving member of Congress, I believe, in North Texas now.
Right.
So how important is that seniority when it comes to this? Obviously, Democrats are in the minority right now, but that may not be the case after 26. So talk to me about that.
Yeah, the seniority is hugely important. Obviously, with me being a senior member on the Energy and Commerce Committee and serving on the healthcare sub, I bring the stories from places like Dallas County and Tarrant counties to Washington, D.C., and I'm able to share that with other members of the committee when we're trying to craft legislation that's going to impact people's health care, particularly when it comes to public health. I think more importantly, though, what worries me about redistricting is that the people that they now want to represent, these areas that, again, are low income, and it's not areas that my Republican colleagues think about much because they don't necessarily need votes in those zip codes to win, but they're not going to be as concerned with public health care outcomes in lower income areas. I don't think that, I get along great with Roger Williams, but do I think that Roger Williams is going to spend a lot of time in Southeast Fort Worth or the north side of Fort Worth, or Craig Goldman is going to spend a lot of time in Southeast or East Fort Worth or the north side of Fort Worth, worrying about disparities in healthcare incomes? No, I absolutely don't think that they will do that. Do I think that Beth Van Dyne is going to be concerned about that? Do I think that Fallon's going to be concerned about that? No, of course they're not. That's not, that's not why they're in. That's not why they're in this. For people like me and Jasmine Crockett and Julie Johnson, we're in this to help communities that have been left out and have been left behind, as well as our other constituents as well. We treat everybody equally. But if you look at the Republican model, their model is to look out for the people that are the red MAGA base in their district and to sort of leave everyone else behind. And so I worry about whether or not we would see my Republican colleagues here in North Texas come and take a tour of this facility to find out how they can be helpful and not how they can make more cuts and hurt people that are very reliant and dependent upon the services that are administered through places like Dallas County Health Department.
So knowing that and hearing you say all that, does that weigh on you as far as what you're going to do in the future?
Yeah, it definitely weighs on me. It definitely weighs on me. I worry about this large of a metropolitan area having the number of voices in Congress that represent low-income communities, Black and brown and Asian communities, and having those voices reduced at the expense of a constituency, quite frankly, that's shrinking in North Texas, that's going to be represented by the majority of people here and only having their voices heard in the Washington, D.C. area. We need to have all voices heard. We need for people in MAGA, red, Parker County to have their voices heard, but we also need for people in West Dallas that are low income and on the north side of Fort Worth that are low income and in Stop 6 that are low income. We need for those voices to be equally heard. And under this map and the way that it's drawn, it's just not going to happen. Their voices are going to be reduced in Congress and they're not going to come around. I can tell you that when they redrew the state Senate district and they put Southeast Fort Worth in a district that stretched to Parker County and Mineral Wells, Phil King never came into East Fort Worth or Southeast Fort Worth to talk with constituents in Stop 6. He doesn't have to. And Phil knows that area. Phil was the police captain. He literally was about to be deputy chief. He was the police captain in Fort Worth Police Department. And he grew up in the Hanley area and was the captain over in the Poly East Lancaster corridor there. He never comes over there to do events or talk to people or try to get people to come vote for him in that area. Why? Because the maps are rigged and they're drawn to flesh out the voices of Black and brown constituencies that live in these areas that happen to be low income. And so we're seeing that it doesn't work in the state Senate, and we don't want to increase that in the congressional delegation, and so that's why I'm fighting.
So how does that guide you going forward? Because you will live in, I believe, Congressman Williams' new district, right, under the new map.
Right.
So how does that guide you on what you're going to do?
Yeah, obviously, it's going to play a big determination in what I do, and I'm just waiting to see exactly, just having some patience to see how this thing is going to play out, because I don't think that this is going to be the end of it. I think that we are probably in the middle of it.
So you wait for weeks? Do you wait for months?
We'll see what happens. I'm going to wait until we hear something back from the judiciary, and we'll know. It's not going to. We'll know. I mean, it'll probably be where it's August now. We'll know in the next month or so, I believe.
Congressman Marc Veasey,
Yeah.
thank you so much.
Absolutely.
We appreciate it.
Absolutely.